For many people, conversations about sexual health begin quietly, often in moments of uncertainty rather than confidence. A man may notice changes in his body during intimacy and wonder whether something is wrong. A couple might find that their connection in the bedroom feels less satisfying than it once did, yet neither partner knows how to begin talking about it. Others may simply feel curious about how to deepen pleasure or strengthen intimacy, but have no reliable source of guidance. Despite how common these experiences are, sexual well-being remains one of the least openly discussed aspects of health. Part of the challenge is cultural. From an early age, many individuals receive conflicting messages about sexuality. In some environments, the topic is treated as shameful or inappropriate, while in others it is portrayed in exaggerated and unrealistic ways. Rarely do people receive balanced, practical education about how the body works, how intimacy develops between partners, or how emotional and psychological factors influence sexual experiences. As a result, adults often enter relationships with little more than fragments of information gathered from media, peers, or the internet. In clinical practice and sexual health education, it becomes clear that the concerns people carry into the bedroom are rarely limited to physical mechanics. Sexual experiences are deeply connected to the nervous system, emotional safety, and a person's internal sense of self-worth. Anxiety about performance, worries about body image, fear of disappointing a partner, and uncertainty about what normal actually looks like can all influence the way intimacy unfolds. One of the most striking patterns that emerges when working with individuals and couples is how frequently stress interferes with sexual satisfaction. Many men, for example, approach sex with a sense of urgency or pressure. They may worry about maintaining an erection, lasting long enough, or performing in a way that meets perceived expectations. These thoughts often trigger a stress response in the body. When the mind becomes anxious, breathing tends to become shallow and rapid. Muscles tighten, attention narrows, and the body shifts into a state that is better suited for reacting to danger than for experiencing pleasure. This physiological response is important to understand because the same nervous system that governs stress also plays a central role in sexual arousal. Healthy arousal depends on relaxation. When the body feels safe and calm, blood flow increases to sensitive tissues, breathing deepens, and the mind becomes more attentive to sensation. But when anxiety dominates the moment, those same biological pathways can become disrupted. In simple terms, the body cannot easily move into a state of pleasure when it believes it needs to stay on high alert. For this reason, one of the simplest yet most powerful tools for improving sexual experiences has nothing to do with complicated techniques. It begins with breathing. Slow, intentional breathing can shift the nervous system out of its stress response and into a calmer state within minutes. This is not just anecdotal advice. Research on breath regulation shows that controlled breathing can influence heart rate, stress hormones, and emotional regulation. Techniques such as slow diaphragmatic breathing, rhythmic inhale-exhale patterns, or structured breathing exercises have been studied extensively in fields ranging from meditation to sports performance. When applied to intimacy, breathing serves an additional purpose. It anchors attention in the body. Many people approach sex while mentally distracted, thinking about work, replaying conversations from earlier in the day, or worrying about how the encounter is unfolding. Conscious breathing helps bring awareness back to physical sensation. The simple act of slowing the breath signals to the brain that it can relax, allowing arousal to develop more naturally. This concept may sound deceptively basic, but its effects can be profound. Imagine a scenario where someone enters intimacy feeling tense and self-critical. Their thoughts might revolve around whether they will perform well or whether their partner is satisfied. In that state, touch can feel mechanical rather than pleasurable. But if that same person pauses, takes several slow breaths, and allows their body to settle, their perception of sensation often changes dramatically. The shift is subtle yet powerful. Instead of racing toward a goal, the experience becomes something they can inhabit moment by moment. Another important factor in sexual well-being is presence. Modern life is filled with constant stimulation, phones buzzing with notifications, endless streams of content, and attention divided across multiple tasks. Over time, this environment can train the brain to expect constant novelty and rapid shifts in focus. Intimacy, however, tends to flourish in the opposite conditions. Sexual experiences often deepen when attention slows down and remains centered on the moment. Consider a couple who have been together for several years. Their daily routines may involve juggling careers, family responsibilities, and social obligations. By the time they reach the bedroom, their minds may still be racing with unfinished tasks and lingering stress. In such circumstances, intimacy can begin to feel rushed or disconnected. The body may be present, but the mind remains elsewhere. Developing the ability to return attention to the present moment can transform this dynamic. Practices that encourage mindfulness, whether through meditation, breath work, or simply pausing to notice physical sensations, train the brain to become more aware of what is happening in real time. This awareness can translate directly into intimacy, allowing partners to respond more intuitively to each other's touch, rhythm, and emotional cues. It is also important to recognize that improving sexual well-being rarely happens overnight. Many people approach the topic hoping for a quick solution that will instantly resolve every concern. In reality, sexual health is more similar to other aspects of personal development. Just as building physical strength or emotional resilience takes time, cultivating a satisfying intimate life often involves gradual learning and experimentation. Working with individuals over extended periods reveals how small shifts can accumulate into meaningful change. Someone might begin by focusing on breathing techniques that reduce anxiety. Over time, they may learn to communicate more openly with their partner about preferences and comfort levels. Later, they might explore new ways of slowing down during intimacy or expanding their understanding of pleasure. Each step builds upon the previous one. One patient once described this process in a way that captures its essence. He explained that he initially believed something was fundamentally wrong with him because his sexual experiences did not match what he had seen portrayed in media. After months of learning about his body, practicing relaxation techniques, and communicating more openly with his partner, he realized that the issue had never been a lack of ability. Instead, he had simply never been taught how to approach intimacy with patience and awareness. Stories like this are remarkably common. They highlight an important truth. Sexuality is not merely an instinctive act that automatically unfolds perfectly. It is also a skill that develops through understanding, communication, and practice. When people begin to view it through that lens, their expectations shift. Instead of judging themselves harshly for perceived shortcomings, they become more willing to explore what actually works for their bodies and relationships. At its core, sexual well-being reflects the broader quality of a person's relationship with themselves and with others. When individuals feel comfortable in their own bodies, able to communicate honestly, and willing to approach intimacy with curiosity rather than pressure, the experience often becomes far more fulfilling. And while the path toward that kind of connection may involve learning new perspectives, the first step is surprisingly simple: slowing down, breathing deeply, and allowing the body to remember how to relax. As people begin to understand how strongly stress and attention influence sexual experiences, a deeper question naturally follows. What actually creates satisfying arousal in the body? Many individuals assume arousal is something that either happens automatically or fails without explanation. In reality, it is the result of a delicate interaction between physiology, emotions, and mental focus. When these systems work together, sexual experiences often feel fluid and enjoyable. When they fall out of sync, challenges such as performance anxiety, premature ejaculation, or difficulty maintaining arousal can appear. From a biological perspective, sexual arousal begins in the brain. Thoughts, memories, sensory input, and emotional context all send signals through the nervous system. These signals influence the release of chemicals and hormones that affect blood flow, muscle relaxation, and nerve sensitivity in men. This process allows blood to fill the erectile tissue of the penis. In women, similar changes increase sensitivity in the clitoris and surrounding structures while also enhancing lubrication and pelvic blood flow. When everything is functioning smoothly, the body gradually moves through stages of excitement, plateau, and eventually orgasm. However, this system is extremely sensitive to psychological factors. Anxiety can interrupt the process at multiple points. Consider a common scenario: a man experiences difficulty maintaining an erection during one encounter. The next time intimacy begins, he may find himself thinking about that previous moment. Even if the thought appears briefly, it can activate stress pathways in the brain. Muscles tighten, breathing becomes shallow, and the body shifts into a state that is incompatible with relaxation. Ironically, the very fear of repeating the experience increases the likelihood that it will happen again. This pattern illustrates how the mind and body constantly influence each other. When someone feels calm and confident, their physiology tends to support arousal. When they feel pressure or self-criticism, the body often becomes tense and less responsive. Understanding this connection is essential because it helps people realize that many sexual challenges are not purely mechanical problems. They often involve a cycle of thoughts, emotions, and physical reactions that reinforce one another. Another aspect that frequently emerges in clinical discussions is the way people interpret their experiences. Human beings naturally create stories about events in their lives, and these stories shape how we feel about ourselves. A single sexual difficulty might become interpreted as evidence of inadequacy. Someone might begin telling themselves that they are incapable of satisfying a partner or that their body is failing them. Once those beliefs take root, they can influence future encounters by increasing anxiety and self-monitoring. Learning to recognize these internal narratives can be transformative. Instead of accepting every thought as a fact, people can begin observing them with curiosity. For example, a man who notices himself thinking, "I'm going to fail again," can pause and acknowledge that the thought exists without automatically believing it. This small shift creates psychological space. Rather than becoming trapped in a cycle of fear, he can return attention to the sensations of the moment. Mindfulness techniques can be particularly useful here. Mindfulness simply means noticing what is happening in the present without judgment. During intimacy, this might involve paying attention to breathing, physical contact, or the rhythm of movement rather than focusing on performance outcomes. By redirecting attention away from anxious predictions and toward immediate sensory experiences, individuals often find that their bodies respond more naturally. Another challenge that frequently arises in sexual health conversations involves unrealistic expectations shaped by media portrayals. Many people unconsciously compare their experiences with images they have seen in films, pornography, or popular culture. These portrayals tend to emphasize exaggerated performance, prolonged endurance, and bodies that conform to narrow aesthetic ideals. Because viewers rarely see the production process behind these scenes, they may assume that such performances represent everyday sexual encounters. In reality, these images often involve editing, staging, and performers selected specifically for certain physical traits. Lighting, camera angles, and even medical interventions can be used to create a particular visual effect. When people measure themselves against these portrayals, they may develop insecurities that have little connection to real-world intimacy. Penis size is one of the most common concerns that arises from these comparisons. Surveys consistently show that a large percentage of men worry that their penis is not large enough, even when measurements fall within the average range. This concern can become so prominent that it interferes with confidence during sex. Yet when researchers examine factors that actually influence sexual satisfaction, penis size rarely appears near the top of the list. Communication, emotional connection, attentiveness to a partner's needs, and willingness to explore different forms of pleasure tend to matter far more. The vaginal canal is highly adaptable, and many sensitive areas involved in sexual pleasure are located near the entrance rather than deep inside. This means that skill, rhythm, and emotional engagement often play a larger role than anatomical dimensions. Understanding this can relieve a tremendous amount of pressure. Instead of focusing on aspects of the body that cannot easily be changed, individuals can invest energy in areas where growth is possible. Learning to communicate openly with a partner, experimenting with different positions, or adjusting pacing during intimacy can all significantly influence satisfaction. Communication, in particular, is one of the most powerful yet underutilized tools for improving sexual experiences. Many couples hesitate to talk about intimacy because they fear embarrassment or rejection, yet silence can create misunderstandings that persist for years. A partner may assume that something feels good because the other person has never expressed otherwise. Another might believe their partner prefers a certain behavior simply because it has become routine. When couples begin discussing their experiences honestly, they often discover that both individuals share similar uncertainties. These conversations do not need to be overly technical or clinical. Even simple questions such as, "Does this feel good?" or "Would you like something slower or faster?" can provide valuable guidance. Over time, this openness builds trust and allows both partners to adapt to each other's preferences. There are also practical strategies that can help couples explore what works best for their bodies. Some therapists recommend treating sexual exploration almost like a collaborative experiment. Instead of assuming that one method should work for everyone, partners can try different positions, angles, or rhythms and observe how each feels. Small adjustments, such as changing the position of a pillow under the hips or altering leg placement, can significantly affect sensation for both people. This experimental mindset removes the pressure to perform perfectly. Instead of viewing intimacy as a test, couples begin to see it as an opportunity for shared discovery. Over time, these experiments create a deeper understanding of how their bodies interact and what brings the most pleasure. It is also worth remembering that every body is unique. Anatomical differences, hormonal fluctuations, emotional states, and past experiences all influence how individuals respond to touch. Because of this diversity, there is no single correct way to experience intimacy. What matters most is the willingness to remain curious, attentive, and open to learning. By approaching sexuality with this perspective, many people find that their concerns gradually soften. The focus shifts away from performance and toward connection. Instead of worrying about whether they measure up to an external standard, individuals begin exploring what genuinely feels good for themselves and their partners. And as that exploration unfolds, intimacy often becomes less about achieving a perfect outcome and more about sharing a meaningful experience together. When people begin applying the ideas discussed earlier, slowing down, paying attention to their bodies, communicating openly with partners, many discover something unexpected. Sexual experiences become less about achieving a specific outcome and more about cultivating connection, curiosity, and shared pleasure. This shift may sound subtle, but it often changes the entire emotional tone of intimacy. One of the most valuable realizations for many individuals is that pleasure itself deserves attention. In traditional discussions about sex, especially those shaped by limited education or cultural discomfort, the focus tends to revolve around risks, avoiding pregnancy, preventing infections, or managing dysfunction. While those topics are undeniably important, they represent only one side of the picture. Human sexuality also exists for bonding, enjoyment, and emotional connection. When pleasure is acknowledged as a legitimate goal, people begin approaching intimacy with a different mindset. Consider a patient who comes into a clinic worried about performance. He may describe difficulty lasting as long as he believes he should, or he may feel frustrated that intimacy seems rushed. When the conversation expands beyond mechanics, it often becomes clear that his primary focus has been reaching orgasm as quickly and reliably as possible. This pattern is common, especially among individuals who learned about sexuality in environments where privacy was limited or where masturbation habits developed under pressure to finish quickly. Over time, that conditioning can influence how the body responds during partnered experiences. If someone's nervous system has learned to associate arousal with rapid stimulation and immediate climax, it may reproduce that pattern automatically. The encouraging news is that these patterns can be retrained. Just as athletes refine physical skills through practice, sexual responses can change through deliberate adjustments in behavior. One helpful approach involves transforming solitary experiences into opportunities for awareness rather than routine release. Instead of approaching masturbation as something to finish quickly, individuals can experiment with pacing, breathing, and sensation. By slowing down and observing how arousal builds, they begin to recognize subtle signals in their bodies, changes in breathing, tension in the pelvic muscles, or shifts in sensitivity. This awareness makes it easier to regulate arousal levels later during intimacy with a partner. Techniques such as edging illustrate this concept well. Edging involves approaching the point of orgasm and then intentionally pausing or reducing stimulation before climax occurs. Practiced thoughtfully, it helps individuals identify where the point of no return lies and how to step back from it. Over time, this practice can increase confidence and control during sexual encounters. However, moderation is important. Spending excessive amounts of time pushing the body to extremes can create new problems, such as tension in the pelvic floor muscles or difficulty reaching orgasm at all. The pelvic floor deserves particular attention because it plays a crucial role in sexual function. These muscles support organs in the lower abdomen and participate in both arousal and orgasm. Chronic tension in this area can contribute to difficulties such as premature ejaculation or discomfort during intimacy. Relaxation techniques, stretching, and mindful breathing can help restore balance to these muscles. Some individuals benefit from working with pelvic floor specialists who teach exercises that improve awareness and control. Another valuable practice involves broadening the concept of sexual stimulation. Many people grow accustomed to focusing almost exclusively on genital contact. Yet the human body contains countless nerve endings capable of producing pleasurable sensations. The skin, muscles, and connective tissues all respond to touch, temperature, and pressure. When individuals begin exploring these sensations, either alone or with a partner, they often discover that pleasure can arise from many parts of the body. This broader perspective can also relieve pressure associated with erections or orgasm. If intimacy becomes narrowly defined by penetration alone, any difficulty in that area can feel like a complete failure. But when couples explore touch, massage, kissing, and other forms of connection, the experience expands. Pleasure becomes something shared rather than something dependent on a single physical response. Some traditions have developed structured approaches to this type of exploration. Practices originating in ancient cultures emphasize slow, attentive touch designed to increase circulation, reduce tension, and heighten sensitivity. These techniques often involve treating intimate areas with the same care one might give to a sore shoulder or stiff neck. The goal is not immediate climax, but rather restoring comfort, relaxation, and awareness in the body. From a medical perspective, the underlying principle is straightforward. Increased blood flow supports tissue health, improves sensitivity, and enhances arousal. When touch is slow and mindful, the nervous system has time to register sensation fully. Over time, these practices can deepen trust between partners while also improving the body's responsiveness to stimulation. Curiosity about other aspects of sexual anatomy sometimes arises as well. For example, the prostate gland in men contains nerve pathways that can contribute to pleasurable sensations when stimulated gently. Some individuals explore this area either internally or externally through the perineum, the region between the genitals and the anus. As with any new experience involving the body, patience and proper preparation are essential. Adequate lubrication and gradual exploration allow muscles to relax and reduce the likelihood of discomfort. It is important to emphasize that such practices are entirely optional. Not every person will find them appealing, and sexual well-being does not require adopting every available technique. The central principle remains the same: approaching intimacy with curiosity, respect for the body, and open communication. Communication itself remains one of the most powerful tools couples can develop. Many partners assume they must intuitively know what the other person enjoys. In reality, preferences vary widely, and even small adjustments in rhythm, pressure, or position can significantly influence pleasure. Couples who treat intimacy as a collaborative process, testing what feels best, checking in with each other, and adjusting along the way, often report deeper satisfaction. One helpful concept in this context is gradual escalation. Instead of beginning intimacy at maximum intensity, partners can allow arousal to build slowly. Gentle touch, extended kissing, or simply lying together and breathing in sync can create a foundation for stronger sensations later. As stimulation increases, occasional pauses or shifts in activity maintain excitement and prevent the body from becoming overstimulated too quickly. This dynamic flow, sometimes increasing intensity, sometimes easing back, keeps the nervous system engaged. It also mirrors the natural rhythms of arousal in the body. Rather than racing toward orgasm, partners move through waves of sensation that build and recede. These changes create anticipation and prolong enjoyment. Ultimately, the most meaningful transformation in sexual well-being occurs when individuals recognize that intimacy is not a performance. It is an interaction between two nervous systems, two bodies, and two emotional worlds. When both partners feel safe, curious, and present, the experience tends to unfold more naturally. Perhaps the most reassuring truth is that nearly everyone experiences uncertainty at some point in their sexual lives. Even people who appear confident often carry private questions or insecurities. The difference lies in how those concerns are approached. When people seek knowledge, communicate openly, and allow themselves the patience to learn, intimacy becomes less intimidating and far more rewarding. Sexual health, like every other aspect of well-being, is an evolving process. Bodies change, relationships grow, and new experiences shape our understanding of ourselves. By treating sexuality as a lifelong journey rather than a fixed ability, individuals can continue discovering new forms of connection and pleasure throughout their lives. And in the end, that perspective may be the most empowering lesson of all. Intimacy is not something reserved for a select few who somehow get it right. It is a natural part of being human, one that can deepen with time, understanding, and a willingness to remain curious about the remarkable complexity of our bodies and relationships.